Hello everyone. In this lesson we'll be talking about pyometras, one of the most common disorders in middle-aged to older intact dogs, so dogs that were not spayed. And what is a pyometra? A pyometra is a life-threatening disease characterized by purulent material within the uterus. Pyometra is caused by an exposure of the canine and feline uterus to long periods of high serum progesterone concentration, usually during the luteal phase of their estrous. It can happen in all breeds, but it is more frequently diagnosed in intact bitches of the breeds Rough Collies, Rottweilers, Cavalier King Charles Spaniel, Golden Retrievers, and Bernese mountain dogs. In some breeds, the incidence of pyometry by the age of 10 is as high as 50%. That is why it's so important to spay the animals when they are younger. Studies show that about 25% of all intact bitches develop pyometry by the age of 10. Cats are also affected, but not as frequently as dogs. In cats, pyometry is more common in cats older than 7 years of age. So, what happens in a pyometra? So, during the estrous cycle, the uterus is under the influence of estrogen briefly, but is under the influence of progesterone for about 9 to 12 weeks after the ovulation. This high concentration of progesterone results in increased endometrial growth, glandular secretions, and closure of the cervix, all these to prepare for potential pregnancy. But the progesterone is also responsible for decreasing the contractions of the myometrium and inhibits the activity of the leukocytes in the endometrium, increasing the risk for bacterial growth and creating the perfect environment for bacteria to thrive. After repeated estrous cycles and increasing age of the dog, the endometrium becomes more and more thick and cysts form within the uterus, a condition called cystic endometrial hyperplasia. Classically, the cystic endometrial hyperplasia has been considered to precede the pyometra since this thickened and cystic uterus secretes fluids that create an ideal environment for bacteria to grow. Bacteria from the normal vaginal flora may ascend into the uterus through the open cervix, including E.coli, Streptococcus, Enterobacter, Proteus, Klebsiella, and Pseudomonas. Something very important to talk about is that a pyometry may not happen naturally. Many cases of pyometry are associated with the use of progesterone-based drugs for estrous suppression, the known contraceptive pill. Also, drugs containing estrogen for estrous induction or pregnancy termination are also associated with pyometry since they increase the effects of progesterone on the uterus. So, any intact female receiving hormones must be carefully monitored for the development of pyometry. A pyometry usually develops during the diestrus, happening 4 weeks to 4 months after estrus, when progesterone has an important role to maintain the potential pregnancy. In an open pyometry, the owner sees the drainage, the most relevant clinical sign in this case. Fever, lethargy, anorexia, and depression may or may not be present. In a closed pyometry, the pus in the uterus is not able to drain outside, so there's no vaginal discharge. We may have a lethargic dog that does not eat with polyurine polydipsia, so that pees and drinks a lot, and that may have an abdominal distension. Fever, vomit, and diarrhea may also be present. In more advanced stages, we may see septicemic dogs in shock, and these dogs may even die if they're not treated on time. So, how to diagnose a pyometra? First, we do a complete blood count. Some bitches may have normal blood parameters, but most have marked changes correlated with the infection. About 70% of dogs with pyometra have anemia because of decreased erythropoiesis, in many cases because of the effect of the toxins released by the bacteria. They have also marked leukocytosis, so increased white blood cells. It is also common, usually higher in closed pyometras. In the beginning, we see a severe neutrophilia with left shift, but in severe illness, the toxins suppress the bone marrow and it leads to neutropenia. Biochemistry panel and biomarkers. So we may see an elevation of globulins, a type of protein that is often associated with the immune system, also an increase in ALP and in total protein concentration. C-reactive protein and serum amyloid A may be used as markers of this disease since they are usually elevated. It is very important to perform an abdominal ultrasound, a more sensitive test than an abdominal X-ray. In this test, we see a thick uterine wall, the lumen distended, with heteroechogenic fluid. I also do a bacterial culture in an open Pyometra, collecting a sample of the vaginal discharge is very useful if we decide to treat the Pyometra medically and not surgically, and the most common bacteria sampled is E.coli. So the bitch, when arrives, may be in a life-threatening condition, and usually we need to stabilize the patient before medical or surgical treatment. Food therapy, treatment of acidosis, electrolyte disturbances, and hypoglycemia may be needed. Many arrive with septicemia, so it's really important to put the patient on antibiotics. Usually we use amoxicillin while on aggressive fluid therapy, so to eliminate the toxins running in the bloodstream. So we have a stable patient, and now what do we do? So we have two options. We treat them medically with drugs, or they go to surgery to perform an ovarian hysterectomy. Surgery is the treatment of election in a pyometra, but in some cases, we may opt for medical treatment when we have a stable dog without signs of sepsis, without hypothermia, without fever. So, however, these dogs should be closely monitored during treatment since the success rate is highly variable and with risk of potential complications as peritonitis and endotoxemia. We can use prostaglandins that increase myometrial activity and that induce cervical relaxation, which leads to the expulsion of the uterine fluids. The most commonly used is the prostaglandin E, also known as misoprostol. Recurrence after treatment is common. In one study, 4 of 10 treated dogs with prostaglandins developed a pyometra after subsequent estrous. Because prostaglandins cause the uterus to contract, it is possible for the uterus to rupture and spill infection into the abdominal cavity, resulting in a life-threatening condition known as peritonitis. You can also use progesterone receptor blocker as aglapristone that may open a closed cervix. The success rate in dogs uh, treated this way is about 75% for long-term recovery and regained fertility, usually reporting a higher risk of recurrence in bitches with cystic ovaries or endometrium. As I said before, the surgical treatment is the preferred treatment because we basically eliminate the problem. The surgery is performed as soon as the animal is stable. If there is uterus rupture and peritonitis, it is necessary an abdominal lavage and drainage. But after all, the surgical procedure, the survival rate is of about 70% in aseptic peritonitis. Dogs with a mild pyometra without sepsis and inflammation of other organs have a good prognosis after ovary hysterectomy. In severely ill dogs, the prognosis is guarded, but with rapid stabilization and surgical intervention, most animals survive. In dogs in which we opt for medical treatment and that have no signs of sepsis, hypothermia, or fever, have a good prognosis, especially in young animals, but always remember that the risk of recurrence is high in animals with medical treatment. And yeah, that was it. Hope you liked. And if you have any question, leave a comment below.